Hi, my name is Tamara Kartal and I work for Four Paws International. I'm going to talk about our project in Constanta, Romania today and what dog population dynamics taught us in the past 3 years. I want to start by bringing up, first of all, what do we understand by dog population dynamics and how do we integrate the different dynamics into projects? So as you probably know, ICAM has this wonderful graphic here that you can see, and it illustrates the various groups of dogs defined by their place in our community as well as their relationship with us. So for example, they're on the street or living in our homes or being rehomed in shelters currently. Those groups make up the entire population, but they are linked to each other and not isolated. But how fluid these groups are and how easily dogs can move from one group to another is very different from place to place. So what is true for Constanza might not apply to the situation you're working with in your location. But in general, it is always good to keep in mind that these groups vary in size and their overlap and connectivity with other groups varies as well. And in order to account for the dynamics and understand them better, we have monitoring and evaluation as an iterative and essential part throughout the DPM system and therefore the management plan that we implement in the end. That sounds all very logic and simple in a way, but implemented, this can be less straightforward. And learning loops are really important, as indicated in this graphic on the right. Asking ourselves, are we capturing the entire picture? Is this all there is to the dog population dynamics? And can it be really a simple yes? Sometimes, but not always. So coming to our example in Constanza, we started the project with our CNBR implementing partner Animal Society in 2021, together with the municipality of Constanza. We did about 4 clinics until the end of 2022, where the team went out and caught, neutered, vaccinated, and returned the dogs where they were picked up from across the city, as well as the port area, each for a couple of weeks. That was low intensity sterilization. But in 2022, we brought in a more comprehensive strategy that started with some exploratory research, so exploration of the dog population, but also of the stakeholder landscape. So we conducted test surveys, interviewed people, and spoke with the mice mayor, for example. That is the new start of the project. So what we did is we started with a comprehensive street dog survey along transects, as well as mark recapture surveys using photos, in which we recorded both cats and dogs and their various details. They were conducted on foot, and we had 65 survey routes, which you can see here in yellow. We conducted them to inform our future steps, but also to give us an idea how many dogs there are, how they are distributed, and what welfare issues they might have. And it was a moment to see how the efforts from the past, with over 600 dogs sterilized, are visible in the public eye. And I should probably say here that the dogs in Constanza all received an ear tag that is visible from a distance. What we found is that there were differences between areas of the city in terms of dogs per kilometer, as you can see in this map. But not really in welfare issues, and dogs were commonly well fed and very rarely had skin issues. However, sterilization rates were, as one would expect, very patchy, so to speak, but something, as I said, one would expect. So very low in general, and in some areas at least with over 20% sterilization, as you can see in this map. Another driver of dog population dynamics is the relationship between humans and pets, as well as street dogs, and that we explored via a household survey conducted with a pollen company, who interviewed over 700 households with a questionnaire we developed and aiming for a 95% confident level. And there, we found that people in Constanza are generally dog lovers, with every third household owning at least one dog and an average of 1.7 dogs per dog owning household. But at the same time, 23% also reported that their pets were allowed to roam for some or all the time. contributing not only to the perceived number of street dogs, but also potentially with offspring born to these pets contributing to the streets. After we did the baseline data collection and the assessment, which included speaking with local shelters, the vice mayor, and other stakeholders such as veterinarians, we came up with a strategy that involved a phased implementation of the high-volume CNVR, together with responsible pet ownership and community engagement activities and education. So reaching most of the fundamental DPM services together with a multi-stakeholder group, but supported by us, with the impact of an improved human-dog relationship, both for pets and street dogs, as well as an increased sterilization rate for dogs in mind. We started to work in the working zone D, and after 2 months of CNVR, there was a feedback loop in which the dog catchers reported that there were a lot of dogs that are concentrated in the industrial area, something the Transect somewhat showed, but not to this extent. And there was an element of trust with the estate owners that they had built, which made an intensive survey of the entire area possible. And by intensive, I mean serving all spaces that are accessible and open to the street. Our assumption is that these dogs are roaming at times we might not have surveyed at baseline, but also their roaming behavior is very much in sync with the businesses they are at home with. So we went ahead and covered all streets in the industrial area in the mornings and in the evenings to find that there were a lot more dogs than the baseline survey suggested. That shifted our CNVR focus to both Zone D and B, because they are the ones that have the industrial area. And until we had reached significant proportions of the dog population there, we would not move to another working zone. But it also meant that we had to reevaluate our initial estimates. And so we had to combine with the residential area results with the intensive survey results from the industrial area, which produced a much higher total estimate that was almost twice as high than initially calculated. We are now estimating 5,445 dogs in total for Constanza, excluding the port. If we had not put in this extra M&E loop, we would have underestimated the population and likely underserved a subgroup of dogs that has guardians, so it's kept fairly well fed, and also has the space and protection to raise puppies fairly securely. A reservoir for potentially new street dogs to move into the residential areas when space arrives. So what we achieved in those 2 years of multi-stakeholder work and communities and data-driven CNVR, we sterilized over 2,065 dogs in total over these 2 years and developed an action plan that is not only driven but also owned by the local communities. In terms of outcomes, we can say that our surveys showed an increased public support for CNVR. We achieved a record sterilization rate of 78% in the industrial area and 52% across the whole city. That means we are not fully there in all areas yet. However, we have made real progress in the 2 years of implementation. And people reported an increased level of care for street dogs, bringing us closer to the impact we want to achieve in DPM programs generally, but also specifically here in Constanza. And last but not least, what does that mean for our future projects in the region, but also for other parts of the world we work in? It reminded us that we need to keep an open mind about our methods and our strategies. It taught us to be open to trying new things and questioning what we were used to, both in terms of data collection and our methods, and the CNVR team adopting new strategies. And we will carry this with us into any new programs we will start anywhere, really. Thank you so much for your time.